Welcome, everyone. Thank you for coming. We are going to be getting started in a moment, but while we are getting ready to begin, I want to tell everybody how you can get interpretation in both ASL and in Spanish. We will be pinning the ASL interpreter so that you will be able to see her or him at all times. And we are also offering Spanish interpretation. For those of you who would like English, you should go down to the bottom of your screen to interpretation and choose English. And then for those of you who want to choose Spanish, you should go ahead and choose Spanish, but I'm going to actually ask Mrna to explain that in Spanish. Go ahead, Mrna. Thank you. That was actually Annabella. That was not Lorna. We are also going to be going live on Facebook, which we now are. Welcome everybody who's live on Facebook. If you would like to have a watch party, you can do so by going on Facebook and clicking on the Disability Voices United page, which I have I'm doing right now and sharing it on my personal page. So go ahead and do that if you can. I want to welcome you all to our webinar. My name is Judy Mark. I'm the president of Disability Voices United. We're an organization directed by and for people with disabilities and their family members. We welcome you all today to our webinar on finally getting our shot, getting access to the vaccine for people with disabilities. We have worked hard to get to this point, and we are pretty thrilled to finally get access. Before we get started, I just want to do a quick plug. Disability Voices United is hosting a big conference on the self-determination program, April 16th through 18th. At some point in the chat, I'm going to ask Ed to throw in there the link for you to register and find out more information. We hope that you'll join us. So I want to thank our wonderful presenters today. And when we set the date for this webinar, I didn't actually understand what a relevant date it was. Because as many of the people in the media have said, today is the 1-year anniversary of when the pandemic was declared here in the United States and when things started shutting down. If you go back to your calendar of what you were doing on March 11th, 2020, it looked like your life might have been pretty normal, and you had no idea that just a day or two away, things would start shutting down all around you and that your life would be changed forever. And we've had a hard year. I remember DVU pivoted very, very quickly. We put up a website about COVID-19 by March 15th. Of 2020, which still exists and still has fantastic resources. We'll put that link in the chat as well. We also started doing webinars regularly. This is our 25th webinar in the past year, and our webinars are all available on that coronavirus website. You can get some great information about a range of issues from mental health to education to employment to racial and ethnic disparities within the context of COVID. We also, at that very first webinar that we had on March 19th, we had Clarissa Kripke, who's here a year later, talking to us. And I remember her saying to me, this is going to be horrible. The whole world's going to be shut down and it's going to last a really long time. And I said to her privately, oh my God, if you say that, people will be unbelievably upset and they will not be able to handle things. And she said, okay, I'll try to temper it a little. And of course, her predictions came true. The one thing that we could never have predicted is that we would have a vaccine a year later, and that, or less than a year later, and that has given us a great deal of hope for the future. And now that vaccine is available to people with disabilities, and that's what we're here to talk about today. So as we always do at Disability Voices United, we start by listening to people with disabilities first, because they are the reason why we are here, and we should always take their lead. And today I'm really excited to have Sean McElveen with us. Sean is a self-advocate. He's also the president and chief creative director of Shawnee. He produces t-shirts and other kinds of materials that you all can purchase, and we'll go to shawnees.com. That's SEANESE.com. Sean is also a cast member of Born This Way, which is an incredible TV show on A&E. If you've never seen it, you can Google it and find the episodes. It's an amazing Emmy Award winning. In fact, Sean is an Emmy Award winner. So we are thrilled to have you here, Sean. And I'm going to let you take it away and tell us what it's like. I know you just got your first vaccine yesterday, right? So yes, how was it?
It was awesome. And I feel happy. And when I got my shot, it hurt me, and I get through it. I love it. I followed. Sorry, I'm gonna say better than stay at home for 1 year.
Go ahead, Sean.
So then don't. I consider like a disability to not get sick. It's not right to say it, but just speak up against that. Because be happy about it, because we are family. So they don't get sick and die. Just be happy. We're all here for each other. We're a family. Because I love you guys. And you guys love me as well. Because we are family. We got this. Guess what? Don't die. Everything will be fine. Back to you.
Thanks, Sean. Thanks, Sean. So your words of advice to other people with disabilities about the vaccine. Would you recommend that people get the vaccine?
Yes, absolutely.
Great. So Mom Sandra, you're sitting right there, I see. Do you want to add anything to, as a parent, how you're feeling about Sean having gotten the vaccine yesterday?
Well, I'm really happy that he finally was able to get it. I mean, it was kind of crazy that my husband and I, as caregivers, were able to get the vaccine a whole month before him. And, you know, and we're protected, but even when you have had the vaccine, you can still contract COVID and still pass it to other people. So I mean, he's only had the first one, so we still have to have the second one. Until that happens, I'm not relaxed. I'm not relaxed that he's not going to still contract it, and because he has staff and they could bring it into his home. I mean, it could happen. So we will rest well after the second shot and the immunities have kicked in.
Wonderful. Thank you so much for joining us, Sean. And some people may have questions for you towards the end. And so speaking of questions, I wanted to let everybody know that some of you emailed me questions in advance, and I have given all of those questions to our presenters today. But you are also going to have a chance to ask questions during the session. And you can do that by going down to the bottom and clicking on Q&A. And I already see there's a whole bunch of questions in there already. That's fantastic. And what we're going to do is try to answer those questions live for you. I'll go ahead and pose those questions to some of our participants. And the other way you can ask a question is through the chat. My preference is that you use the Q&A because the chat is constantly moving and it's hard to keep track. So thank you all. So we're now going to move on to our next speaker. Pete Cervinka is the Chief of Data and Analytics and Strategy at the Department of Developmental Services, or DDS. And Pete has been really leading a lot of the efforts internally at DDS to try to make sure that people with developmental disabilities are able to get access to the vaccine. And so I've given Pete a whole bunch of questions, and I know that just yesterday, I think, or the day before, DDS issued a directive on this. And so I've asked him to talk a little bit about that. So go ahead, Pete.
Yeah, great. Thanks, Judy, and for the invitation to be here today, and really appreciate everybody's interest in the topic. It's obviously, as we heard from Sean and his parents, an issue on top of mind for everyone. You know, I think folks know beginning March 15, there's a whole bunch of folks who are newly eligible for vaccination. And those folks include people with disabilities, and those things are defined. I'm going to encourage folks to check the state's covid19.ca.gov. That's the main website. And in there's an entire section of that website dedicated just to vaccines, for information about them, where to go to get them, who's eligible for them, and all of those kinds of things. That's actually going to be updated tonight for all of the populations eligible beginning Monday. So a really valuable site, that covid19.ca.gov website. Because we knew that these populations were going to become eligible on March 15, the department earlier this week issued the directive that Judy mentioned. A directive provides some instructions to regional centers on things that they need to do. And basically that directive does a couple really important things. First, it provides a reminder, just because people are eligible for vaccination does not mean that a vaccine is actually available to give to them. That vaccine supply is limited, and I know that many of you hear on the media all the time about efforts to increase the supply of vaccine around, but there isn't enough for everyone, which is why it's been prioritized. So that's really important. Starting Monday, almost just over 4 million folks across the state become eligible. And even if not all of them want the vaccine, which I personally believe they should get, there just isn't 4 million doses for them to receive it. So that directive first provides that reminder to people. Then it directs regional centers to provide personalized letters to each consumer who is not already known to be vaccinated. For example, a number of regional center consumers who live in a long-term care facility already have been vaccinated, so they don't need one of these letters. The regional centers are also directed to conduct outreach to and make contact with regional center consumers ages 16 through 64 who are not already known to be vaccinated, or to their family or conservator or the administrator of the licensed residential facility where they live. The outreach to consumers who are most at risk from COVID-19 complications is prioritized by that directive. When regional centers make that contact, they're asked to both provide some information and also request some information from people. The information that they will be providing includes information about where consumers can obtain a vaccine, information about how to schedule an appointment to receive a vaccine, offer options for assistance in accessing vaccines, including making appointments, helping with transportation, or providing public telephone hotlines or websites or other similar resources. For example, a number of county public health departments have dedicated hotlines and websites to provide information on those topics. They're also going to be potentially providing links to our department's frequently asked questions. We're hoping to post that tomorrow, but definitely by Monday. And there's about 35 frequently asked questions across a number of topics that those frequently asked questions will address. And then the all-important reminder to all of the consumers, if you get one of these personalized letters, you need to remember to bring it with you to wherever you go to get a vaccination. You may not need it. Hopefully that's true. But in case you do, you should have it with you. While the state policy says that we don't have to verify your eligibility, there's also local government rules and medical provider rules. So make sure that you take that personalized letter with you when you go. When regional centers make contact, they will also request certain information from you. You don't have to give them this information, but it would be really helpful if we had it in your medical record. And we're asking regional centers to ask you for the date of the vaccination and the brand of the vaccine you received, and whether or not you had any significant reaction to it. And I'm going to pause on that piece too. That sounds really scary. The state statistic says that less than 3 people out of every 10,000 people who get the vaccine have a significant reaction to it. A sore arm is normal. A fever for a day or two is normal. They're actually good that those things happen because it's a sign to you that the vaccine is working with your immune system to generate a response. So most people will have a very mild symptom. So we're only asking for things that potentially require you to go to the hospital or get an emergency injection of Benadryl or some other antihistamine. They're also going to ask whether you've chosen to decline to be vaccinated. We know some people, for a variety of reasons, may feel it's unsafe, or they want to see what happens with other people before they take it themselves. So we will want to know who is declining it. And we will also want to know whether the consumer made any request for assistance in scheduling and accessing a vaccination, and what kind of assistance they want. Maybe it's just information or assistance with transportation, for example. The reason we ask for that information is that it helps us monitor to make sure that people are safe and their health is protected. And it also helps us monitor that the equity goals we'll discuss later tonight are achieved as well. And so that covers the description of what is done by the directive that we issued earlier this week. There are 2 other questions I was asked to talk about. What should people do is the first one. Any available vaccine that you can get is the vaccine that you should get. Supplies are limited, as I said, but also all 3 vaccinations have roughly the same benefit to them. There are also federal supplies of vaccines and state supplies of vaccine. And so each of those supplies is going to a different place. So wherever you can go to be vaccinated, you might go to your doctor, and your regular doctor would love to help you, I'm sure. Or you could go to, say, the LA Forum, to a mass vaccination site like that to get it. But whatever they have available for you is the one that you should check, one you should get. Just a reminder again, regional centers are mailing to you, and in some cases emailing to you, the personalized letter with your name on it. You should take that with you. You may not be required to have it, but you definitely should just in case. You would hate to wait in line or go somewhere for an appointment and then be told they can't help you. So let's avoid that issue by bringing with what you can, and just in case. What if a person has a problem at a vaccination site where they're not accepting the regional center letter? We think we learned a lot from the experience we had with consumers who were age 65 and over. We have worked very hard with other departments, including the State Department of Public Health, to ensure that medical providers and vaccination sites are aware that if you're a regional center consumer or an IHSS recipient or participating in a home or community-based waiver program and several other programs, that you may be bringing a letter with you and they should accept that. We didn't have that clarity when we did the 65 and over population. And so from the get-go, we want to be sure that that is clear. Also, at some federally supplied sites, including the FEMA site in Los Angeles County and some pharmacies that are supplied by the federal government has told those locations to prioritize teachers and childcare workers through the end of the month of March. Obviously, we don't control the federal government, but if you come to a pharmacy or a federal site for vaccination, just be aware that they may not have enough vaccine to provide to you. So don't be discouraged by that, but don't quit. There are also lots of places that you can go, and you may have just a different date to explore as well. You should be checking first with your doctor, then with a local pharmacy, or with the County Department of Public Health. And by now, most county departments of public health have really good websites and telephone services to give you the help that you're looking for. Although it's not statewide, but it is working and functional in Los Angeles County, myturn.ca.gov is a live website that can help you determine whether you're eligible and can connect you as well with available appointments. So again, if you're having trouble finding the website, don't quit. There are lots of places you can go to get that vaccine. I want to close my remarks with equity efforts. Leinani Walter, in a moment, we'll talk a little bit later about equity efforts. But I just want everyone to know that equity, including for people with disabilities, is a priority across the administration's COVID-19 response efforts. Whether it's ensuring the availability of testing for COVID or prioritizing people with disability and others beginning on Monday, or in using data to identify gaps where perhaps we need to increase the supply of vaccination to fairly cover everybody, we're really committed and a lot of work is being done there. Last week, the governor announced that 40% of vaccine supplies for a short time will be dedicated to communities in the Healthy Places Index. These are communities that are vastly underrepresented in vaccinations to date. And there's a lot of work going on in those communities to equip them with vaccine, work with community-based organizations, and do outreach to the demographic and other population groups who disproportionately have been affected by COVID-19 and its health consequences. So there's a lot of focus on equity too. And we're really excited that the data that's available to us is allowing us to ensure that vaccine is matched with where it can do the most good for society overall. I did see one comment fly across the chat that I want to address, and I had a suspicion that it would come up. Myself and Ernie, who's next, and Leinani, who's after Ernie, all three of us work for the State Department of Developmental Services. The things that we can talk about relate to the developmental services provided through regional centers to people in California. But I want to be really clear that although we don't have any authority or jurisdiction to talk about other populations, I want to be really clear that if you meet the definition in the state's vaccination plan, for example, people living in the community who are not regional center consumers, but perhaps work with independent living centers, you too are eligible starting March 15. So while I talked a lot about regional centers, our directives to regional centers, I just want to be really clear that any person with a disability that meets the definition in the state's plan is eligible starting on Monday the 15th. If you have any question about whether or not you're eligible, the COVID-19 COVID-19.ca.gov website is the place to go. And they have a dedicated section just on vaccines that lay out who's eligible and your options for where to go to get it. And they have links to the My Turn website, and they talk about also pharmacy options and mass vaccination sites. So just because the three of us are talking about regional centers and regional center consumers more generally, what we are talking about and the avenues to get vaccine are common to everyone. And so I think that should be made clear for folks. Thank you. I hope I didn't go too fast for our translators as well. And I'll turn it back to Judy for the next panelist.
Thank you so much, Pete. That was really, really helpful. And I know that we are really heavily focused on the developmental disability community, which is the space that DVU works in primarily, although with our COVID work, we work across disabilities. We're going to talk a little bit more about that in a little while. I also just wanted to point out before we move on to Ernie that while the state can provide guidance to local health authorities like counties and cities on how they should be distributing vaccines to people with disabilities and what kind of verification they're requiring, each one might be doing something different. And some communities may be significantly more flexible in what they're asking for, and others may be more strict. We, of course, are pushing for the greatest level of flexibility, especially because in 2 minutes, President Biden is about to announce that he is going to require all states to get rid of the tiers by May 1st and to offer vaccines to anyone 16 years and older who wants it. So certainly we want to make sure that folks with disabilities who particularly at high risk can get in there and get that vaccine as soon as possible. But our goal is to get everyone vaccinated, right? So I'm now going to move on to Ernie Cruz. Ernie is the Assistant Deputy Director for the Office of Community Operations at the Department of Developmental Services. And Ernie has been tasked with a lot of questions, specifically around what has been the outreach to regional centers, what have they been told that they should be doing. I've seen a lot of questions in the Q&A asking when are we going to get this letter? Do we have to ask for it, or are we going to get it automatically? All those kinds of things. So go ahead, Ernie. Thanks for joining us.
Thank you, Judy, for the opportunity to join you guys tonight. I really appreciate it. So among the questions I've been asked to address deal mostly with communication, and obviously communication and outreach has been and continues to be an important priority for us. And so the first question, what has been our outreach to the regional centers? Among our communication efforts with the regional centers, obviously there's been the directives that have come out including the one this week that expands the vaccination efforts to the 16 to 64 age group. And when each of these directives come out, we continue to have regular meetings with the regional center executive directors, and also participate in a variety of meetings with different executive staff at the regional centers to provide these updates and guidance on the directives that are coming out. Another important part of our communication is just hearing from the community and from regional centers and sharing what are some of the best practices and some suggestions of actions that are working across regional centers, and really trying to provide regional centers with information that is important for them to know as far as their outreach to the community. So with regards to our communication to the regional centers, it's consistent, and we make every attempt to give them the most up-to-date information on each of the directives that come out. With regards to how the regional centers are reaching out to families, individuals and families, there was a directive that we issued at the end of January that asked regional centers, that directed regional centers to put together a testing and vaccination plan for their communities, and provide outreach and information to their communities about their efforts. Regional centers are reaching out to individuals and families through a variety of methods. Aside from telephone calls, they're using email, websites, social media, e-news, and their e-newsletters to provide updates. Regional centers are also teaming up with their family resource centers and community partners to enhance their outreach efforts. I highly recommend, if you haven't signed up for your regional centers newsletters, that you consider doing that, because the regional centers on a frequent basis, weekly, sometimes daily, provide updates that they get from the department, and also information about their local efforts to provide updated information with regards to testing or vaccination events, information about personal protective equipment. So those newsletters are really informative and provide a lot of good updates. Regional centers also utilize the Everbridge notification system to send out alerts to their families and individuals being served. And so there's a variety of ways that the regional centers are attempting to get information out to the families. Additionally, the directive that I mentioned earlier that came out at the end of January also required regional centers to contact all their individuals being served and families. And so that constant communication and our direction to keep that communication going has been an important part of their outreach efforts. Another question that I was asked to speak to was with regards to what should a family do if they're having issues getting a letter from their regional center. You know, if a family or individual being served is not getting a response from their service coordinator, they should ask to speak to the manager or the director for the regional center. If they are not having success getting in contact with someone at the regional center, they can definitely reach out to the department for assistance. And we have a dedicated email address, ddsc19@ dds.ca.gov. That's monitored on a daily basis, and we can assist with assisting in making that contact. Another question I was asked was, what is your guidance? What is our guidance to regional centers about individuals who have sensory issues or can't tolerate a mask or are afraid of needles? With regards to those sensory issues, there's a variety of resources available. One option is definitely to reach out to the regional center and ask for support or ideas from their clinical staff. There may be some direction or guidance that can be given with regards to some best practices to try and help that individual get through those sensory issues. There could be the opportunity to allow the individual to choose from, if the issue is related to wearing a mask, it could involve allowing the individual a variety of mask types and colors, just introducing the individual to the mask. There's also other options, such as using a neck gaiter as a mask or a face shield with fabric reaching to the chest. That might be looser and feel less restrictive to the individual. There's also another option, could be consider using a face shield rather than a mask. As far as resources on the web, consider accessing some social story resources. And there's a variety of social stories. Some are for children, some could be used for adults, and we'll provide some links on some of those social stories to help introduce the individual to the idea of wearing a mask or getting vaccinated. The last question I had was, what about people that can't leave their homes? And that one's obviously a challenging situation. If someone cannot leave their home to go to one of the vaccination sites, one of the first things they should consider doing is consulting with their primary care physician or contacting their local public health department to see what options are available. This area is something that regional centers are working on to develop resources for those particular situations. And regional centers are partnering with local health, with their local health offices, reaching out to home health agencies, and trying to come up with mobile vaccination options for these type of situations. And also for situations where, for those families that might live in more remote areas where getting access to the vaccine is more challenging. All right, I think that's all I have, Judy.
Thank you. That was great, Ernie. I just want to let everybody know, hot off the press, I think Pete might know this, but the California Department of Public Health, whom we invited to come on the webinar today, but who couldn't or didn't respond, just released the guidance on this, literally right this second. And it lists this is huge, and I'm going to put the link to this in the chat. I'll put it in the chat right now for those of you who are who want to see it at the same time. Hold on, let me get it to everybody. Why is that not working? There we go. So it basically says, and this is really critically important, that the criteria for people who have a range of physical and behavioral disabilities, I'm not sure why they call it behavioral, but that is what they call it. Examples include all enrolled consumers of regional centers, independent living centers, in-home supportive services, community-based adult services and adult day health centers, Medi-Cal HIV/AIDS waiver, Medi-Cal home and community-based alternatives waiver, Medi-Cal assisted living waiver, the program of all-inclusive care for the elderly, California Children's Services Program if the child is 16 to 21 years old, and California Genetically Handicapped Persons Program. So that's pretty huge. That includes a lot of people. That means that all IHSS recipients 16 years and older just need to bring in their either a pay stub that one of their providers has or any kind of documentation that they receive IHSS. And that, or if you're a member of the independent living centers, or obviously we've been talking about regional centers. So that's pretty huge. I mean, obviously there are other health risks and conditions and disabilities that, that will also be covered. And you can certainly bring a letter in from your healthcare provider showing that you have one of these disabilities. A pharmacy can also help to make your appointment as well. So verification documentation of the diagnosis or type of disability is not required, but instead anyone meeting the eligibility requirements will be asked to sign a self-attestation that they meet the criteria for high-risk medical conditions or disabilities. That's pretty huge. I'm reading this for the first time as I'm saying it to you, hot off the press. They are not asking for any documentation at all. They are saying, using self-attestation. That's not a common word. Attestation means that you are basically saying, yes, I have a disability and you should believe me. I do not have to provide you the information. Now, I would still bring your letter from the regional center or IHSS or your doctor. I'd still do that just in case the counties are not going to follow the state's rules. We saw that happen with the parents and the healthcare providers. But this is extraordinarily exciting, and I'm really happy to break the news to everybody. We're going to move on to our next speaker, who's going to be talking a bit about equity. And thank you, Ernie. I want to now introduce Leinani Walter, who's the Assistant Deputy Director for Service Access and Equity at the Department of Developmental Services. And once again, we know that Leinani works with a specific community. However, I think that the words that she says and the issues that she brings up can certainly it can be considered that it's a priority for the entire state. And the entire state government. So thank you for joining us, Leinani.
Thank you, Judy. Really appreciate the breaking news. It's like a live news feed here. So it's always that way with DVU. So I'm very thankful to be part of this conversation today. So as many of you may or may not know, our section under community services focuses on communities and service access and equity. And this certainly during the pandemic, one thing we do know is that many of our communities of color have suffered, in fact, in many ways, the greatest of all of the pandemic. So I wanted to talk a little bit. I know we're talking about vaccination 1 year later, and that truly is amazing that vaccination and vaccines are available. But I want to take us back a few months to talk about at the beginning of this pandemic, what the department's efforts were in reaching out to communities of color. I think it's important to do that because the education and the materials and the things we need for vaccination to get people the right information and to get them to get a shot requires building some of the trust. And it requires getting good information and having people understand the importance of vaccination. So I'd like to start with just talking about the department's efforts to ensure equity began, as you know, Judy noted, 1 year. I started at the department during the pandemic in March. And the first thing I did was help with surge capacity and trying to connect with our community-based organizations as quickly as possible. We heard very early in the pandemic that many of our families not only didn't have critical services that they needed, but weren't able to access basic needs like food, like the loss of a job, and not even have the ability to get public transportation. So we knew in those beginning days that we needed to make some contact. So the first thing our section did and the department did just overall, the first thing was to ensure cultural competency in communication and resource sharing. That meant that we wanted information that we were sharing about COVID-19 and the pandemic. In order for it to be broadly understood, we needed to make sure it was provided in accessible languages, native languages that people understood. We also wanted to make sure that it was in a format that was plain language so that lower literacy levels individuals could understand it. We also wanted to have ASL videos and have the ability for as many formats as possible that people could understand critical information very quickly. We relied on our community-based organizations to help us not only get the information, but also to train communities, help people to understand how to wear a mask, help people to understand the importance of social distancing, and doing so in languages like, of course, Spanish, but also Hmong and Vietnamese. And many of our community-based organizations pivoted critical staff time to ensure that some of these videos, like we're doing now on Facebook, were available on YouTube videos in other common places that people would go for information. CBOs have been trusted community connections for families long before and long after I might be around. But what we did know is that making those early connections helps us today. It helps us to get information out very quickly in ways that people understand directly to the communities that we need to reach. So I'd like to just, pause for that moment and say that community engagement has been a critical way, a new way that we've been able to reach our communities of color. We have held since the very beginning in March, instead of quarterly meetings, we had to pivot very quickly to weekly meetings with community organizations as well as regional center cultural specialists. We wanted to make sure that we were on the same page as to what resources were available, but also taking the time to listen to our communities directly as to what they needed, as to, we thought, sharing resources means also understanding what families need. And that isn't the same as saying, what do we have on paper? But for particular communities, they needed certain resources very quickly. I think it's really important for us to note that the community, the monthly calls with cultural specialists and community-based organizations that are part of our Service Access and Equity Grant, that is an opportunity for us to share information, much like DVU is doing today, which is we have had various trainers come from Cal OES, Department of Social Services, to talk about food access and the availability of online EBT so families could order food in the very early days of the pandemic. We also had presentations and continue to do so. We had California Department of Public Health come in January and specifically talk to our CBOs with resources and toolkits about the vaccine. In addition, we also are thankful to have Catherine Blakemore and her partnership and consultation helping us with getting information out about the vaccine. Catherine's been part of our conversations pretty broadly, but with our CBOs, she's been willing and able to be a resource for us. In addition, we've had conversations, of course, with our DS Task Force, our Service Access and Equity Work Group, hearing from the work group in real time about the kinds of resources and the challenges that communities have faced, have helped us to not only look at efforts with directives and work with regional centers, much what Pete and Ernie have talked about, but it helped us to really target those efforts and figure out that although online virtual services may work for some communities, we found that that was not as easy for our communities that are in our tribal communities living in areas that web access was not available. Ensuring that some materials and accessible languages were not available. So making sure that we were thoughtful about the way we looked at resources and services. And that, again, was always through the lens of equity. I think I also just want to touch base briefly on ensuring one of the big areas that we spent a lot of time last fall on was ensuring that our community-based organizations had direct access to PPE. And that meant reaching out to our CBOs, as well as CBOs that were part of previous grant years with our Service Access and Equity Grant, as well as CBOs that served individuals with developmental disabilities from other community organizations not connected with DDS. So it was an effort to get as much PPE and resources out. And as Ernie mentioned, the kind of alternatives, we heard from some of our communities that wearing a mask was challenging. And we wanted to find ways that we can help and support those needs with some of our most vulnerable communities, in which case we made sure to send out, and I think to date, just with our CBOs, we sent close to 3 million masks, 3,000 to 4,000 face shields for those who could not tolerate a mask, as well as several thousand gallons of hand sanitizer. And this, again, the department spent a lot of time ensuring that PPE was available directly to the regional centers for service providers, but we also wanted to make sure that our CBOs had the opportunity to distribute PPE. Not only did they distribute PPE in partnership with the department, but they also ensured that the information was available in accessible language, but also that critical resources were part of that distribution, a safe distribution in the community. And I believe the question, or a few of the questions I was asked, are one of the topics are, how are you ensuring that underserved communities and people of color are getting the vaccine? Well, as we've talked about today, the best that we can offer is ensuring that we have good resources, information. Pete has already talked about the extensive work the department's done to outline directives and to provide guidance and directives on how the regional center will support communities. From our section, from the department, we wanted to make sure that we provided current and updated information as quickly as possible. Once again, reaching out to our CBOs to ensure that they are our direct connection to the community, and offering trainings like CDPH joining us in January and having Dr. Ron Chapman and Dr. Martha Dominguez talk in detail about the efforts and the information about vaccines. Having a conversation with our DS Task Force African American Focus Group back in December, there was an important discussion about efficacy of the vaccine and past history and challenges with really understanding what does a vaccine mean, and does it mean the same thing to all people? And making sure that we get accurate information out to people means that we need to not only have it in the right way, in a accessible manner, but also that it's a trusted source that's sharing the information. So when we say, are we ensuring, the best we can do is ensure that we're getting the information out. The other piece that I think is really important is we've worked with Cal OES. We've worked with Vance Taylor at Cal OES, and one of the things we did was provide contact information for all of our CBOs so that they could be prioritized in access to the vaccination. That was really important. As Pete noted earlier, the perspective that equity has been an important aspect of all parts of our COVID response, as well as the vaccination effort. And that's certainly something that in our section, we're trying our best to ensure that the information, the resources, and the links that we can help make communities, such as priority access for vaccination, were really important. A good example of how we've connected CBOs and regional centers is a good example, Alta Regional Center recently having a community-based organization host a vaccination clinic and offer and focus on communities of color in that vaccination effort with Dignity Health is a good example of how some of our CBOs are working with regional centers to get vaccination opportunities available. I think the other question, Judy, was, is there specific outreach that DDS is recommending to ensure these communities are informed and getting access? As Ernie and Pete both spoke about, the March 19th DDS directive certainly does require regional centers to outreach to consumers and families ages 16 to 64 and talking about the CDPH guidelines. That is certainly an important aspect, that it is a very clear outreach effort that we're trying to make, but we're also trying to make sure, and part of this directive, I just want to highlight, is that regional centers can make contact in a variety of ways that meets the needs of the individuals and families served, but that the contact should be made in preferred languages whenever possible. Again, making sure that the contact that we make is consistent with our view of equity and ensuring that all of our efforts are always with an equity lens. So I think, Judy, that may conclude my remarks in answering a couple of questions you had. And if there are other things, I'd be happy to answer them.
Thank you so much, Leinani. I really appreciate all the hard work that DDS has done for our community, for me personally, for our family. You've done so much. So I really appreciate that. Okay, so I'm going to pose a few questions because the rest of our webinar is actually going to be, we have an incredible presenter, Dr. Clarissa Kripke from UC San Francisco. And I want to just ask a few questions to our DDS folks, particularly as I mean, a lot of these questions have come in. Although I think that the California Department of Public Health could not have been more perfectly timed to say that people can use self-attestation. Thank you, CDPH. But let me just ask a few of these questions that would be specifically for you as opposed to for Clarissa. So I guess a basic question that people are asking is, and I'm going to spotlight all the people from DDS. So any of you can answer at any time. Are people supposed to actually proactively reach out to their regional center, or are regional supposed to reach out to them?
This is Pete. Our directive instructed regional centers to proactively mail personalized letters to people, and they got a template for that where all they needed to do was insert the name of the consumer and also the regional center contact information. So that should proactively come. Some may come through US Postal Service. Other regional centers were using a mix of that and emailing people PDFs. If you don't get it, but please be patient with a regional center. The directive just came out the other day and some of them have 20,000 letters to send out. So please be patient. But if after about a week or so you don't hear, please do contact the regional center for that. But you shouldn't need to do that. It should come to you. And I was so emphatic about that, Judy, I lost part 2 of your question.
Well, no, that's okay. You actually answered it. I mean, especially now that counties are being told by the state that people shouldn't have to bring proof of disability, but I still think it's a really good idea. I mean, a lot of people are asking questions about how to make appointments, which I know is not under DDS's responsibility in any way, shape, or form. Some of them are talking about how in the My Turn system, which is a state system, there's no place to put down that I am a person with a disability to check that box. They're also finding so LA City, I know, has one. San Francisco City has their own. LA County has its own. They use something like Carbon Health. I mean, there's all different ways to make appointments. You can also go directly to Kaiser, to CVS, to Walgreens. And this is my advice because there's no way that DDS would ever say this officially. My advice is, if there's no category, just pick a damn category to make your appointment. Because once you get there next week, you are eligible. They don't literally, having gotten a vaccine myself, When you get to the vaccination site, they don't sit there and say, oh, you checked X box, let me make sure and line you up with that. It is a very fast system. You're moving through quickly. Just pick whatever you can to get your appointment, okay? I will not, DDS is not telling you to do that. This is me, an average volunteer mom telling you to do that. Just make your appointment, get it whenever you can, as soon as you can.
Judy, it's Pete. I will not say anything that you just said, and I'm not going to endorse it either, but I am going to point out for folks on the My Turn site, all you have to do is click the register and determine your eligibility button. There's a button that asks for your age range, where it asks at the moment where you work. If you just click other and go to the next box, it actually does have a box on it. That box is live now that says, do you have any underlying health condition or disability which increases your risk? So you can be completely honest when you're using the site. So I just want to add that. And for people eligible March 15, they're making further, even easier to use enhancements for the site that will go live on Monday. So I saw people noted that in the chat, but I wanted to say it out loud. On Monday, myturn.ca.gov is going to have an upgrade on it that makes this even easier and even clearer for folks.
That's great. I think that some people were saying in the chat or in some of the questions I've received that when they click that other and then click the underlying health conditions, it says something like you're not yet eligible, and so you can't even make an appointment yet.
And there's an important caveat that often gets buried. There's a lot of hype about myturn.ca.gov. It is not live for every county yet in California, and it won't be until April 1st. So it's not the universal solution for everyone, but it is live in some of the big counties. And unfortunately, they don't list it. But even if you can't make an appointment, you can sign up to be contacted by MyTurn. And when it goes live in your county with appointments, they will reach out to the name and the phone number or the email that you register in the site to tell you that it's your turn. So even if you can't make an appointment on Monday, and again, supplies are limited, that site will at least keep your info and then ping you back when it's time.
So the other advice that I have for folks listening is that just you should be trying on multiple sites. You should try My Turn. You should try Carbon Health. You should try the CVS site. You should try Kaiser. Everybody should know that Kaiser is giving vaccines to people who are not members of Kaiser. You don't have to be part of the Kaiser network. So I would try all of these, and which I know is very hard and really inaccessible. So it leads me to my next question. And I don't know, Pete and Ernie and Leinani, if you know the answer, but I've been hearing here, at least in LA where I live, that a number of the regional centers are stepping up and trying to organize vaccination sites on their properties, in their parking lots or whatever, which I think is outstanding. And so I'm wondering if you've heard about this. How can people find out when it happens, all that kind of stuff?
Well, Alta, I did mention, Judy, in my comments, I'm sure Ernie knows more about this, that Alta recently hosted 2 vaccinations. There may be more, Ernie, I don't know, you might know, where that they've already hosted with Dignity Health and partnered with a community-based organization. So it was all 3 that actually hosted that. So it was through that, that I think it was a 2-day period that families, individuals served by the regional center would get a code and would be able to make their registration. So again, that was organized, and it was a lot of, frankly, I think it was a lot of coordination, Ernie, if I'm not mistaken. It required a lot of coordination with people, the way it was done, but I've heard really tremendous things about it, that it was really successful.
Yeah, I believe Alta teamed up with Safeway.
Yeah.
Like I said, they did 2. I think they have another one coming up.
Yeah.
Golden Gate did the same thing with Safeway. Central Valley has had a very good partnership with Fresno Department of Public Health. They're just, regional centers are very open to finding ways to do vaccination sites at their site and making those connections. So that's an ongoing effort on their part.
Yeah, it's and I know that we are also at DVU is working with the LA County Sheriff's Department to run some mobile clinics for people with disabilities. LA County Sheriffs have been going out and doing mobile clinics for seniors. And so they have gotten access to Johnson & Johnson vaccines, which I think is really important, that one and done for certain members of our community who may have a fear of shots or maybe can't really get there twice. So they have gotten access to several hundred Johnson & Johnson vaccines, and we are compiling a list with other community-based organizations of individuals in LA County who need a home-based mobile vaccination. And that's going to be another really important piece of this, is that we have got to make sure that there's lots of different ways for people to get vaccinated. That's another thing, and I'm going to bring this up to Clarissa as well. You know, there are people who have, you know, who have intense fears of shots, and so therefore it requires a village to help them get their the vaccine. And so I think that we want regional centers, we want service providers, we want community-based organizations, we want all these different groups to be involved in helping get those shots into arms. So I'm really excited about that. All right, there's actually 129 questions in the Q&A. And so I think we've answered a lot of them. Deborah's asking, she's largely bed bound and she wants, how do people like her get the vaccine? I'm not sure, Deborah, what city you're in, but I know that many communities have already established mobile clinics for bed-bound seniors, and they're now just going to shift those resources to people with disabilities who are not able to get to a vaccine site. I actually had a meeting along with other disability advocates with Mayor Garcetti of the city of Los Angeles, who absolutely committed to move the city's mobile vaccination units to people with disabilities. And so, you know, I think that it's really important for us to advocate systemically with the counties and the cities who are providing some of these vaccinations. And I see people in the chat are literally getting appointments as we're on the air from Kaiser and other places. That makes me so excited. So that's terrific. All right, so I'm going to move on to our next speaker. If those of you from DDS, if you can hang, because I'm sure that there's going to be a lot more questions. I know you can multitask and other things you have to do, but I'd now like to move on to Clarissa, because a lot of the questions that we've been asked both before this and since we've been on is that we are hold on, I'm going to spotlight you so everybody can see you. Is that we are, you know, is it safe? People have underlying health conditions. What should we do? And I said this at the beginning. Clarissa is like my guru on this stuff. She's like a seer, a person who sees into the future. She saw a year ago where we were going to be, and I was like freaking out about it. But it is true, and I think that now she's going to see into the future of where we are and where we can go with the vaccine. So thank you for joining us. Oh, I should introduce you. I should give your title. Clarissa is the director of the UCSF, University of California, San Francisco Office of Developmental Primary Care. She's also a board member of an amazing organization called Communication First, that is a sister organization of ours. So thank you for joining us, Clarissa.
Thank you. I'm going to share my screen now. And so COVID-19 vaccines, I want everybody to have the basic information. So I'm going to try to speak slowly and clearly. Oops, how do I advance my slides? There we go. So there are 3 vaccines approved. There's the Pfizer, the Moderna, and the Johnson & Johnson. The Pfizer and Moderna vaccines are very similar. The Johnson & Johnson works a little differently, but all are highly effective in preventing hospitalization and death from COVID-19 and are effective in even the new variants. And so the best vaccine for you is the vaccine you can get. The Pfizer vaccine is a shot, then you wait 21 days and get a second shot, and it needs very deep cold storage. The Moderna vaccine is a shot, and then you wait 28 days, and then you get a second shot, and it needs cold storage, but this slide is probably, it's not regular refrigeration, it's colder than that. So how do the mRNA vaccines work? Those are the Pfizer and the Moderna vaccines. They teach the body to recognize the spike protein on the coronavirus. The coronavirus is the virus that causes COVID-19. So once we've been exposed to an infection, our immune system in our bodies can produce antibodies. Antibodies are proteins in the blood. The proteins can recognize viruses and it can stop them. This prevents us from getting sick or making illness, or it makes the illness less severe. Vaccines help us make antibodies without having to go through the illness. The COVID-19 vaccines are mRNA vaccines, and this is a new way to make a vaccine. This is how it works. The coronavirus is covered with spike proteins. Those are the red knobs on the yellow coronavirus in the picture. The spike proteins help the virus get into our cells, multiply, and make us sick. Without the spike proteins, the virus can't spread in the body. The mRNA vaccines have pieces of genetic code in them. These are instructions for our cells to make copies of the spike protein. This is shown in the purple. After getting a vaccine, our cells make spike proteins. They don't make the whole virus, so you can't get COVID-19 from taking the vaccine. You can see the blue cell is making the proteins. The vaccine doesn't change your genetic code. After our cells make the protein, our body sees the spike protein and makes antibodies. When those antibodies see the coronavirus, they recognize the spike protein and stop it. When the spike protein is stopped, the virus can't get into our cells and make us sick. After your body makes the protein, it destroys the mRNA from the vaccine so it doesn't stay in your body long term. How well do they work? The mRNA vaccines work extremely well, 95% efficacy, and that is not only in the studies, but it seems to be turning out to be true as we see what happens when we start to give these vaccines to tens of millions of people. The Johnson & Johnson vaccine is only one shot. It can be stored in a regular refrigerator, and it uses a well-established way of making a vaccine called an inactivated adenovirus. So they've taken an adenovirus, which is a cold virus, and they've changed it so that that virus is how they get DNA into your cells to make that spike protein, but you can't get a cold or get sick from the adenovirus. And then once the DNA is in your cells, then your cells make spike proteins and your body's immune system works the same way as for the mRNA vaccines. Here's a picture of that. So is it safe? The short-term safety with Pfizer and Moderna includes the first shot. A lot of people get sore arms and redness at the injection site. With the second shot, a lot of people get tired, they have headaches, and they may have fevers. For most people, the symptoms didn't last very long, a day or two, and didn't interfere with their regular daily activities. About 30% didn't feel well enough to go to work the next day. So when you're scheduling your appointment, pay attention to the fact that you might not feel well the next day. 4.5 million cases and millions of shots 4.5 cases per million shots of a treatable severe allergic reaction have been reported. So we've given the shot now to, the last time I looked into it, it was 40 million people, but it's probably more like 60 million people now. So we have a lot of experience giving these shots to a lot of different people. All of my patients have been fully vaccinated, and my patients include people with very complex disabilities and many medical problems. That's my patient population, and they all did very well with it. The people who had severe allergic reactions to the shot are rare, only a few cases for every million shots we give. And those allergic reactions are treatable. And that level of reaction to a severe reaction to a shot is similar to other shots like the flu shot and the measles, mumps, rubella shot and other shots that are commonly given. So this vaccine is as safe as other types of vaccines you've probably had. The short-term safety with Johnson & Johnson comes from its trial, the research on it in 8 different countries, and it causes arm soreness and redness at the injection site and a similar headache and tiredness and fever. And there have been a very few severe allergic reactions reported. It also works very well. It's good, but the effectiveness is a little bit lower than the other vaccines, but it's very good against severe COVID-19 or death. You might get a moderate or a mild case, a little bit more likely, but it was tested more recently, so we know that it protects against some of the new variants. So it's hard to compare the vaccines against each other. And I wouldn't say that one is necessarily better than the other. And again, the vaccine you should get is a vaccine that you can get an appointment to get. So the efficacy is high. It was tested in all different groups, people who are over age 65 in both men and women. It was tested in people ages 16 and up, and they're doing trials now of younger people. There were many different races and ethnicities in the trials, patients with all sorts of medical problems like obesity and high blood pressure and diabetes. And the side effects do occur, but they're well tolerated and limited to 1 or 2 days. And over 40 million people have been vaccinated, and there have been no deaths from the vaccine. There are some things we don't know yet. We don't know if the vaccines prevent infection without symptoms. So could you get COVID, an asymptomatic case, a case where you don't get sick, but you still have the virus and could pass it to others? We don't know how much they lower your chance of giving the virus to somebody else if you got a case where you didn't get any symptoms. There may still be some very rare side effects. Again, we've given this to 40 million people so far. And so I think we have quite good data at this point and quite good experience at this point, but there could be some very rare side effects that we don't know about. It hasn't been studied in pregnancy. It's been given in a lot of pregnant women and in breastfeeding, and it's been given to a lot of breastfeeding women. But if you're pregnant or breastfeeding, you might want to talk to your doctor because we don't have research about that yet, although we do have quite a bit of experience. Kids, we don't, it hasn't been studied yet. We're in the process of studying it. We don't know what the long-term side effects might be of these vaccines because they've only been around for a short period of time. We also don't know how long they're going to last. We know that once you get the vaccine, you have good protection for a while, at least 3 to 6 months, but we don't know if you're going to need a booster shot at some point or how long it might last. And we don't know what type of booster shot you might need in the future. So make sure that you keep very careful track of your vaccine card to know exactly when you got your shot and which shot you got, because it's very likely that in the future, as we learn more, they're going to recommend that maybe you get a booster shot down the line. So you want to know what you got and when you got it. So is it right for you? With anything new, like a COVID vaccine, it's reasonable to be worried or concerned that something new could have unknown risks or unknown side effects. But we have to compare that to the known risk of COVID-19 disease, which in our population of people with disabilities can be quite severe and is much more likely to be severe. And we know at this point, there's so much COVID-19 virus out there that if you don't get vaccinated, chances are sooner or later you're going to get exposed and you might get very sick from it. So you have to compare the unknown risks of the vaccines that could come up with the known risk of the COVID-19 disease. So after you get your shot, a lot of people want to know whether they can go back to their old lifestyle, but for the time being, things aren't going to change, at least if you're out in public. So you still need to wear a mask, stay home as much as you can, keep your distance from other people and wash your hands. However, if you are fully vaccinated and the vaccine has time to work, for the Johnson & Johnson vaccine, that's 2 weeks. It's 2 weeks after your last shot. So if you have the Moderna or the Pfizer vaccine, you have to wait for the second shot. With the Johnson & Johnson, just the first shot. 2 weeks later, if you are in your house or in a place with other people who have had their vaccine and the vaccine has had time to work, you don't have to wear a mask anymore. But if you're out in public, you still need to wear a mask and distance. So I got my shot, and I also signed up for the V-Safe system, which is a way of keeping track of, it's the Center for Disease Control's way of keeping track of how people do with the vaccine. And since these are new vaccines and we want to know as soon as possible if there's anything unexpected that happens or and how much the side effects are, I think it's very helpful if you can sign up for this, for the V-Safe system. You sign up for the system and then it sends you texts every few days and asks you how you're feeling or if you're having any side effects. The vaccine is free. There's no insurance needed. Sometimes places that are giving you their vaccine might be able to charge your insurance for giving the vaccine, but the vaccine itself is free. If anybody is asking you for a credit card or asking you for money or telling you that you can give them money and they'll get you a vaccine sooner, then they're cheating and it's a fraud and you shouldn't do it. The vaccine is free, the government is paying for it, and nobody should have to pay for their vaccine. Vaccines and legal status. Vaccines are for everyone. There's no questions at vaccine sites about your documentation status. The government is providing this to everybody, regardless of your documentation status. And it is illegal to share information from a vaccine, about a vaccine with ICE or with authorities. People with disabilities are eligible on March 15th, and here's a list of who's eligible. It's very broad for people who need services and supports because of their disability, or who have chronic medical problems. It includes a lot of people. This is the list, and I'll give the slides so you can look it up if you want to. COVID vaccine, we're committed to, the state is committed to getting a vaccine to everybody. And while vaccines have been very scarce and there's still a limited amount of vaccine, that is going to change very soon. They are working really, really hard. The Biden administration has worked really, really hard with the manufacturers to speed up the ability to make these vaccines and get them to states so that they can make appointments, and it won't be very long before there's plenty of appointments for everybody. So I know everybody's anxious to get their vaccine as soon as they can, but you should know that it's not going to be that long before we have more vaccine than when the problem is going to be, how do we get the vaccine to people, and not that the vaccine isn't, that we don't have enough vaccine to go around. So where to get your vaccine? We talked about the website, the myturn.ca.gov. Also, your county public health department has a website, and I would register for both websites and they can send you reminders about when you're eligible and how to get your vaccine, or you can also go to vaccine providers' websites, like people mentioned CVS or Walgreens, and try to make an appointment. And so that's what I have to say. I'm going to stop sharing. And let's see, and let Judy take it from here if you have questions.
Larissa, yeah, there's a bunch of questions. And I think some of these questions are a little bit difficult because they're asking you medical questions, and these are obviously not your patients. So I want to.
I also be careful about confidentiality, because this is being recorded and it's being sent to everywhere. So you don't want to say anything that would be private.
I'm not going to say anybody's names, but you know, are there certain health conditions? So let's make it generic. Are there certain health conditions that you would say to an individual, you might want to not get the vaccine because of X, Y, and Z? I mean, is there something, because I just got an email today from a friend saying, oh, I can't get the vaccine because I have an autoimmune disease. And of course, I have an autoimmune disease, and I got the vaccine, and I actually had no side effects from either the first or second shot. So, you know, I'm not sure where people are getting this information from.
So there are very few reasons why you absolutely should not get a shot. One of those is if you have an allergy to the ingredients of the shot, and there aren't very many ingredients. There's the mRNA itself, and there is a coating on it that is polyethylene glycol or Miralax that is around the vaccine. If people have very serious allergies, I'm not just talking about runny nose, but I'm talking about the kind where you have to carry around an EpiPen with you because you might have a life-threatening allergy to something, then you're at higher risk. Again, the risk even for people who have very serious allergies is extremely low that you'll have a serious reaction, but you're at higher risk of having a reaction than the average person. And I might choose my vaccination site at a hospital center or somewhere like that. They'll also ask you to stay at the vaccination site a little bit longer. Instead of just 15 minutes, they'll ask you to stay for half an hour to make sure you're okay. But even people who've had severe reactions, they have anybody who's giving vaccines has EpiPens there. They have the ability to transfer you to the hospital if needed. And again, those kinds of reactions, even in people with severe allergies, are very rare. And we have now given the vaccine to 40 million people. Most of them had lots of medical problems because they were in nursing homes or long-term care facilities, and we just aren't seeing a lot of severe problems. Again, we don't have information about pregnancy and breastfeeding, but we've given it to a lot of pregnant women and breastfeeding women so far, and we haven't heard information that it's been a problem as of yet, but not that much time has gone on for us to be sure about that. But I think we know it's very dangerous to get the disease. And so, so that has to be weighed against any possible risk.
Wonderful. There, and this anyone can answer, but I know that you might have a special way because you work with a lot of patients with very significant challenges of all different kinds. A lot of people are asking, I have a family member who's afraid of needles. I have a family member who's going to run away. I have a family member who needs 4 people to hold them down to normally get a vaccine, or who can't wear a mask, so can't go to a public site. What is your general advice for folks?
Be creative. So for some people who can't wear a mask, a drive-through site might be best for them. For other people, having a pill to help with anxiety, like a little bit of Valium or Ativan, might help them get through. I never recommend that people be physically restrained unless they, not their parents or somebody else, but unless they consent to that. By the time you're 16, you can make your own decisions about that. But I think traumatizing people, although it may get you the vaccine, this time it'll make getting medical care in the future more difficult and scare people. And so I don't recommend that. I think it would be better to find a way. If you're afraid of needles, you probably have other medical things that have been deferred, like your dental care or other things, and we might need to help you with anesthesia and get your shot at some time when you're having other things done. And there were some suggestions by the speaker before about being creative, like different color masks or practicing or using a face shield. And I think being very patient, explaining what's going to happen, even if you don't think people understand, they understand more than you do. And if you take a respectful approach towards people, explain what's going to happen, explain exactly what to expect. Bringing someone calm to be the supporter is really helpful, because if you're anxious, they're going to be anxious. And I have a problem with that. I am very calm around everyone but my own kid. And when I'm with my own kid, I'm a nervous wreck. I want them to perform well. I want them to do well. And I do not help the situation. So often my child has said, you cannot support me when I go to the doctor. You need to stay away because you are a nervous Nelly and it doesn't help me. So so find the person who works well with you, who's calm, and who can get you through it. And you can try rewards. You can like candy or whatever it takes. And I think some people will need home visits and will need a site where people can be more patient, take more time, or maybe have a private room where they can get their vaccine. So I think we should be working with our regional centers, our schools, and other places to help the people who are struggling the most.
So I have a totally different question, and you may have, if you already answered this, because I was answering some stuff in the chat and Q&A while your presentation was going on. So I apologize if you answered this. If a person had COVID-19, how long should they wait until they get the vaccine?
That's a good question. So we are recommending that people who have had COVID-19 get vaccinated, because it will improve your protection against the disease. You're probably immune for at least 3 months, so you might not have to be rushing to get your vaccine. And people who've had the vaccine, I'm finding, tend to have more side effects. So there might be, waiting for your immunity to settle down a little bit before you get your vaccine might make some level of sense. The only other thing is you shouldn't give a vaccine to somebody who is sick on the day of the vaccine. So if you have a cold, if you have a fever, regardless of if it's COVID or for any other reason, if you're sick, wait until you're better before you get your vaccine.
Yeah, and that's a really important thing. They ask you these questions when you're going to get your vaccination, or how are you feeling? Do you have a fever right now? Because we know that produces, that's not a good thing. People are asking a lot about the links to make appointments. I put in the chat, somebody was saying that the San Andreas Regional Center was doing a special vaccination clinic, and they just announced how to make those appointments. So if you're in the San Andreas Regional Center, I posted it in the chat for you to be able to make appointments directly with your regional center. So here's an interesting question that I've seen a lot. If your child is conserved, is there anything special people need to bring or anything they need to do? And I think contrasting that, because as people may or may not know about me and my organization, is that we are very much supportive of alternatives to conservatorship. If there's a person who's an adult who is unconserved, and there needs to be an attempt to present consent, what is your advice in both of those areas?
You don't need a doctor's order for a COVID vaccine, but you do need to consent, to agree to it, to say, yes, I understand the risks and benefits and I want this. Either you or someone legally authorized to make a decision on your behalf, whether that is a conservator or a power of attorney or somebody else who is authorized. You will need to do consent, and getting valid consent is a challenge for our community. And as we're waiting for people to get appointments, we can be working on solving those problems, getting power of attorney paperwork done if necessary, or explaining to our loved ones about the vaccine and so that they can make their own decisions, and supporting their decisions about it, because they will have to sign a consent or make a mark or indicate somehow that they agree.
Yeah. Everybody should know that I have a son who's 24, who's unconserved, who was just able to get his vaccine, and he was able to just put a little mark on the paper saying yes. You have to make it real for people. Like, it's not just like, do I want a shot? Most people say, no, I don't want to get a shot. But if you say, this is a shot that will help you go to Disneyland when it reopens and keep you safe there, then they're like, I'm all in. I am all in for Disneyland. So you have to make it real for folks, and on what the benefits are of having a vaccine, just like any of us would need. Here's an interesting question. Is it true that vaccines do not work on people who are overweight?
That is not true. They did test the vaccine in people who are overweight and obese, and it's worked. So I think that over time, we may decide people who are overweight need a booster shot sooner, or might need a different dose or something like that, or that one shot works better than another. But for right now, there's no special recommendation for people who are obese. We believe it works. They were included in the clinical trials, along with people with other kinds of conditions, and we should proceed, because the mRNA vaccines are very potent, because it's telling your own body to make these spike proteins. So I think my gut, without any research or evidence, is that it will be effective.
Great. All right, we're gonna just ask one more question because we're over our time limit, and I want to make sure that our ASL and Spanish interpreters are able to get to their next meetings, because they probably have more things. People are wonderfully excited about the Johnson & Johnson vaccine. This makes me so happy, because when I heard that it was slightly less efficacious, I was thinking, oh my God, people are gonna sit and not take the vaccine because they're gonna wait to get Pfizer or Mrna. But in fact, it is a highly beneficial one and done vaccine. Have you been hearing, I know that it's just recently been approved, and so therefore it's not like there are that many doses out there already in the state. I would say that if you have a child, or you are a person that really needs to just have one and be done with it, there will be more available in the coming weeks, and you may want to wait for that. But would you recommend that as well, Clarissa?
I think that's an individual decision, but I think that that's exactly right, that there'll be a lot more coming up. And once vaccines in general are not as scarce, then we will be able to be a little more choosy about which vaccine we select. If you need something in particular, I talked to your doctor. Right now, the doctors are discouraging people from being picky about which vaccine, because that's just going to make it overly complex to get vaccines into people's arms. And we need to do that as quickly as we possibly can. So in general, people aren't going to help you choose one vaccine over another. But if you have a very special case, there's probably a workaround if you talk to your doctor, or if, like you say, if you just wait.
Great, thank you. And I'm just seeing, just to confirm for those people who were not at the beginning of our webinar, that if you are not a member of a regional center and you're not going to be getting a letter, and you receive services through an independent living center, or you're a member of an independent living center, you receive services through in-home supportive services or IHSS, you have a doctor's note attesting that you have a specific disability that would make you at very high risk of a poor outcome from COVID. All of this documentation can be brought with you if you choose. They are not required according to the state. However, localities may in fact go farther and require some things. So it might be worth bringing some kind of documentation. But if you're not a regional center client, there are definitely other things, other kinds of documents that you can bring. So, please, please keep us informed about how things are going out there. We will try to work with you if you are seeing at the local level that people are not taking your regional center level, or not taking your letter from your doctor. Please let us know, because we'll try to advocate with the state on this and make sure that people get the vaccine who deserve it. And remember that the president just said that everybody's going to have access to this vaccine by May 1st. So we are really getting closer to the end of this nightmare. However, we should all continue to stay safe. As Clarissa said, please continue to wear your masks. Please continue to socially distance from people who are not in your household, or not people that have certainly gotten a vaccine. Wash your hands a lot, because there's other things out there besides COVID that you could catch. So I want to thank all of our amazing presenters. Sean, thank you, Sean. You were fantastic. So happy you got vaccinated. And Pete, Cervinka, Ernie Cruz, Leinani Walter, and Dr. Clarissa Kripke, thank you all so much for being part of this. It is, to me, I have an incredible sense of optimism for the first time in a very long time, and I'm seeing the light at the end of the tunnel. Thank you, everybody, and please stay safe out there and be well. Bye-bye.
Thank you.
Thank you.